the issues are in the tissues. You know, you had this emotional experience, and the emotional experience creates change in your inner and outer world. I mean, the outer world is the test, and your inner world is it's showing up in your skin. You know, so that's just it. And so glad you talked about that, because a lot of people don't realize how interconnected their health concerns are with whatever's happening in their life. I mean, they could be having something great happen or something terrible, and you know, I have to stay open to what the possibilities are. I can't just fight it out and hope everything will change doing it my way. We can't do the same thing over and over again and expect a different result. We have to change what we're doing for things to get better and for things to change. That was Jim Rohn, the guy who used to coach all these real estate people, used to say that, and then he became real famous and he's passed away. Anyway, it was really interesting the way he used to tell everyone things that were like so logical, and then people thought, oh, what, that is it that simple? Well, maybe.
All right, welcome everyone to Living the Next Chapter. I always wanted to say this. I've heard this before, sitting patiently in the waiting room, but the doctor will see you now. And I've always wanted to say that, so I finally get to say that. I'm so excited. This invitation today popped up in my email just recently to get together and talk about a book through a mutual friend, Dominic Damaski, and Dr. ILYA SKOLNIKOFF is with me today, and we are going to be talking about a lot of great things, the author journey, and a lot of health things which are going to help us all. And Dr. ILYA, so great to have you. Thank you for making time for me today. Welcome to Living the Next Chapter.
Thank you for having me. This is great. This is, I feel a little cold here in Canada, but other than that, it's good.
My fireplace was just on, so it's really toasty in here right now. So,
okay.
Yeah, but anyway, it's really great to have you on. It is, again, when I saw your message pop up in my inbox, I thought, how did that happen? First of all, I'm like, and then I did a quick YouTube search on you and some Google searching and went, this is a doctor that has traveled, shared a message, connected with amazing people. And I thought, wow, I'm so blessed to have time with you today. So
thank you for saying that.
Yeah, if you're not sure what I'm saying, do a quick search on your own for the doctor here, and you'll see what I'm talking about. But I'm amazed at your background and who you've had a chance to interact with, who you've addressed in your journey. Can you take me a little bit behind the scenes of how building community around your message, how that really matters to you as a doctor?
Well, you know, healing is about getting a chance to make a difference in the community and in the lives of each person that you're helping with their health. So, well, let's just say a person who takes care of sheep, right? I know it's a terrible analogy, but if you're herding sheep and you're taking care of sheep, you better have their best interests in mind, because number one is they need to eat, you know. Number two is they need to have a place to go to the bathroom, and sheep eat a lot of grass, right? So if you're not figuring out where the best pastures are that are healthy grass, where the sheep are safe and they can go and not get attacked by wolves and that kind of thing, then you're not going to have any sheep. Okay. The way that I think community is really important is that's how I started my practice, and I've continued it for over 16 years. I always put the patient's best interests in mind. For example, just to give you an idea, at first I was, even at the very beginning, I went to chiropractic school because I had a lot of health concerns myself. This will take a couple minutes just to go over it. But I was, wow, this is way back, probably, you know, we're talking about I was 19 years old or even younger than 19 years old. And I went to this UC Riverside in Southern California, and I had this really bad acne as a kid. I had 3 or 4 different eyes. I can remember I was in this, I was working for this doctor, and I was going to the restroom, and then I looked back in the mirror and I saw, looking back at me, there was at least 3 eyes, right, on my face. So I proceeded to go in and reduce the eyes down to approximately 2 eyes, and an explosion took place, and this white pus clouded the mirror and started coming down the mirror. And then there's a whole new dilemma. I'd have to wipe off the pus off the mirror, then even though I'm a male, I'd need to apply some makeup to make it look as though nothing had ever happened. And this process went on for quite some time. So we'll fast forward just a little bit. I found out that, there's things you can do for acne. You can get the things on the market like benzoyl peroxide, and you just get that. It's like you just get that anywhere, right? At any Safeway or something like that, or Albertsons. Then there's Retin A, which is stronger. You get that as a prescription. It's a synthetic vitamin A that women often get to reduce lines. And you can get something called Cleocin T, and there's something called tetracycline, which you have to get as a prescription. But hey, my father was a medical doctor. He was a psychiatrist, so he could just write the prescription or send me to his buddy, the dermatologist down the way. But every time I got these different things, the problem was I was not thinking about what was causing my acne. And when I did think about that, my father said, well, it's probably just a little too much spicy food, or it just happens, when you're younger. And that's not true. It doesn't happen when you're younger for no reason. There's a cause. Every health concern has three causes: a structural, chemical, and emotional cause, which is why the name of our company is called Triad of Health, Family Healing Center. Triad means three. So there's three sides of every health concern. There's the structural side, like the part of your body; the chemical side, like my using Retin A and Cleocin T, and I finally ended up using something else. You'll have to excuse me for a minute, but it was the big daddy of the acne medications. I used Accutane. Okay. It said on the label of the Accutane, this may cause women who are going to become pregnant to have birth defects of their yet-to-be-born children. This may cause all kinds of problems with your vision. It may cause you to have a toxic liver. And at the time, I didn't even know what a liver was, because I'd just gone through the basic biology classes in high school. I knew about something called the 10 life cycles, and I didn't even study anatomy. So liver, I asked my father, what's a liver? He said, oh, well, it's a liver. It's over here. And you need it for things like metabolizing fat. And I said, well, should I take this Accutane? He said, oh, it's up to you. You decide. If you want to really want to get rid of the acne, you can, but, it may cause a little trouble with something. I said, okay. I was only 19 at the time. So I took this Accutane, and sure enough, I had this, on the label, it said, may cause dry skin and floaters in your eyes and flush skin and all these kind of things. I had this really, really dry skin. I was seeing like little dots and stuff, especially if I looked at like a white background or a blue sky, and I was having floaters in my eyes, and I was getting, then all these other things started happening. I was getting angry all the time. I was having all these symptoms that I found out were like female hormonal imbalances, because both men and women have female hormones. It's just women have more of the female hormones and men have more of the male hormones. But I was getting like warm flashes. I'd get sweaty at night. I'd have exhaustion. I'd have this really bad, sharp stabbing pain between my shoulder blades. So I went through all this stuff. I was having like an irritable bowel syndrome. I was going to the bathroom, number 2, about 6 times a day. And it was never solid. And it was as embarrassing as it may sound and upsetting. I mean, it's true. I'm not making this stuff up. Okay, that's I guess the point, right? It's like this was like my life at that time. So when I'm talking to people on the phone or I'm talking to new patients and they're saying, well, I have really severe chronic fatigue, I'm thinking, wow, I can't believe you had to go through that and you're going through it now, and I've already been through that. And then I go through and I start to help them. So I'm taking it seriously because, we're all connected in this way. So I think the community is like myself, right? I'm treating the people who are like me. I'm not treating somebody who's different than me. They may be having a different part of their life that's coming up now for them, or a different facet of who they are, one that I don't want to see that's part of who I am. But that's really what's happening. Is it's something maybe that I wish, like I'm glad I don't have any of those symptoms anymore. So long story, as long as possible, I ended up finding, who could help me with this problem that I had. I didn't realize it, but when I was going through all that stuff, I had that pain there in between my shoulder blades for a reason. And so I didn't know what that reason was, though. So one day I was in the gym and I was lifting weights. Now I'm older. Now I'm around 30 years old. So, I mean, there had been 7 or 10 years that had gone by. And I hear this ping sound, like a ping, just like that. And what had happened was I tore 90% of my pec major muscle on one side of my body, which was scary. So when I went to the hospital, they said, well, we don't really know that you fractured anything. We don't know what's wrong. We can take an x-ray, but we still won't know because an x-ray just looks at the bone. It doesn't look at soft tissue. So you might have torn a muscle or you might have fractured something. So they didn't see a fracture. Then I went to the surgeon and he did an MRI, and sure enough, I tore 90% of that muscle, and they were able to fix it, and I got physical therapy and all that kind of thing. And then fast forward a couple years, I'm in chiropractic school and I'm adjusting another patient, and I have this tear sound this time, no ping, right? I tore 90% of the other pec major muscle on the opposite side of my body. So, both of these things are torn, and then they do end up healing fairly well. So, but, you got to think, why would somebody tear the same muscle on both sides of their body if they'd never torn another muscle in their life? And the reason why I tore those same muscles was those muscles are related to the liver. And I can remember I was getting really angry all the time and having cloudy thinking and all these symptoms that have to do with a toxic liver. In fact, the girl I was dating at the time, I'd yell at her at the top of my lungs just because she made me so angry, and she was doing these things that, really pissed me off. But it just so happens that it wasn't really her. It was me. I was angry because I had a toxic liver. It wasn't really something she was doing, even though I was convinced it was. See what I mean? So, all right. So then I finally found somebody. I was in chiropractic school, and I was going to all these different people to get help. I mean, I'd seen all these different healthcare providers. I don't even know how to put it into words. I noticed that even though I'd gotten 40 acupuncture treatments. I was studying acupuncture in school. Why do I use acupuncture to help my patients? Well, I was getting 40 acupuncture treatments and they didn't help. So God only knows why I use acupuncture now. But anyway, and I was taking all these herbs, and I got about 20 chiropractic adjustments. Every couple weeks I'd get one. And I was still not getting any better. I mean, I wasn't getting worse, but I was kind of like at a plateau. So then I found somebody who had different skills and different training. His name was Dr. Bruce Shin, and he's still practicing in Temecula, California. So I drove almost 2 hours to see Dr. Bruce Shin from where I was at in Whittier at Southern California University of Health Sciences, School of Acupuncture and Oriental Medicine, Los Angeles College of Chiropractic. Anyway, I drove 2 hours to see this guy and 2 hours back, and in one single treatment, he made a huge impact on my health. I was having to take all these herbs and nutrients before seeing him, but after that one treatment, my energy went up. I just needed 2 or 3 different things to take to help me with my health. I had a better mood. I was thinking more clearly. I was like a can-do kind of person instead of a I can't do it kind of person. I was much more upbeat and sleeping better at night. I wasn't perfect, but I mean, I'd say I was like 70% or something like that better. So, what is community about now? It's about knowing that I thought I was 70 or 90% better, but I had just gotten one treatment, right? So we had just begin to unpeel the layers of an onion to get to the core of the onion, which was the core of my health concerns. I mean, that was quite a while ago. I'm 52 years old now, and my health is awesome. And then I thought my health was great, but I had to go back to Dr. Bruce Shin and find other healthcare providers as well to really heal up. It was not, I mean, I say to people, it's the liver that was causing me to be angry. My liver was toxic, and it was toxic from the Accutane, and that's what was the big issue. And now they've had class action lawsuits against Accutane and everything, which I didn't have a great opportunity to participate in. But anyway, the thing that was key was, this is how life works. It's like a circular thing. It's not really linear. So if I have patients come in to my office and they say, well, I feel so much better now. You treated me. I think maybe I don't even need to come back. Well, yeah, you're doing better. Yeah, that's good. But you might need to follow this path to health that we've put you on, where there's a symptom relief, correction and strengthening, neurologic hormone and brain support, life, and then the I feel good phase, and then there's life repair, and then there's supportive care. If you don't follow that, then you can do really well. You could lose 85 pounds like Christine Mellinger did in 4.5 months, almost 5 months. But then if you don't do something to prevent all those symptoms from coming back, then you're going to work really, really, really hard to get up to the top of that mountain. And then, you're going to have to go back up the mountain again, right? You're going to just be put back down to the bottom of the mountain, and then you're going to have to climb all the way back up again. And this is one treacherous mountain, right? I mean, there's all kinds of like snakes and scorpions and things on the way up the mountain, so you probably don't want to do that. So yeah, I mean, I didn't have to, just all the things that my patients do that I think they shouldn't do, and I give them a hard time for. I might be more critical than I should be every now and then. I did those things too, right? So it's not, I did that, right? I mean, somebody sometimes takes like a growth hormone or something that they shouldn't take.
Yeah.
I did that once, like, so I gotta consider how everything is connected.
It's interesting when you're talking about looking at the results instead of looking at the symptom. I remember when I was young, going to the emergency with my family. My parents took me in because I broke out in this rash. Like, it was everywhere. Oh my God. And I remember sitting there with the doctor as a kid, freaking out with all this red spotted rash everywhere, all over my body. And instead of just giving me a prescription and sending me home, the doctor looked at me and said, "When is your next exam?" And I'm like, "What? What does school have to do with this? I've got spots everywhere." He's like, "Are you worried about your next exam? When is that?"
Interesting.
I'm like, "I have an exam tomorrow." He's like, "You need to relax. You'll be fine. Your test will be fine. You'll be great. You'll do wonderful.
Yeah.
Here's something for the pain, but you just need to relax."
Yeah.
And I walked out of there going, healthcare is more than just, okay, well, here's the result and how can we fix it? Is, well, where's the source? And in my case, it was just stress. And even though I'm only a young person, I was overwhelmed by this exam that was pending. And he saw through everything and just deconstructed it for me and said, "You need to relax." And that was the best combination of a pain medicine prescription and life advice to give me a whole picture of how I can be better. And when I'm listening to you, that came back to mind is it's more than just treating the result, right? When you talk about the acne, it's more about than just treating what you see. It's, okay, what's causing this without hurting us in the process? Like you mentioned in your message to me in email, it's not about unnecessary surgery or medication, but getting to the point where you're like, listen, we need to focus in on the things that are the root, and maybe we can address that, and you'll see the results kind of demonstrate in your life. Am I on the right path?
You got it. Yeah, it's the issues are in the tissues. Actually, on my screen, you're over this way, but the issues are in the tissues. You had this emotional experience, and the emotional experience creates change in your inner and outer world. I mean, the outer world is the test, and your inner world is it's showing up in your skin. So that's just it. And so glad you talked about that, because a lot of people don't realize how interconnected their health concerns are with whatever's happening in their life. I mean, they could be having something great happen or something terrible. And, people, this one lady, I guess the other day, I'm trying to think of what happened to her. She came from Poland to the United States, and I think she had like a divorce right before she came. And right after the divorce, she had this really terrible car accident where the car's like tumbling, it's spinning, and then she's thrown out of the car, and then she goes to the emergency room, and like her life hasn't been so good since then. But she never even thought, well, wait a second, maybe it was because of the divorce. I mean, you and I, we're thinking about it right now, and anyone
exactly.
Hearing me talk would think, well, yeah, I mean, you get a divorce and you have a problem. But it's not you. It's not you or I or the person listening. It's this lady, right? Who that's her life, and now she can't think clearly, and so we have to start helping her with that. But she's going to have to deal with the divorce and her romantic relationships and how that's played itself out in her life. Otherwise, she'll still not be able to think clearly. It may be a tough battle for her to see the relationship, especially if she can't think clearly, right? I mean, it's like, it makes it like it gets harder and harder the more symptoms a person has to get rid of those symptoms. In other words, if I had a serious illness or disease like Graves, let's say Hashimoto's thyroiditis, where it's a really severe digestive trouble that affects the thyroid. If the main thing is I have to know that the thing that's the problem is whatever it is. I have to keep an open mind. If somebody's telling me maybe it has something to do with my diet, I can't keep insisting that it has something to do with my career. Or if somebody's telling me it's my husband, I can't keep thinking it, or wife or whatever. I can't keep thinking it has something to do with my kids. I have to stay open to what the possibilities are. I can't just fight it out and hope everything will change doing it my way. We can't do the same thing over and over again and expect a different result. We have to change what we're doing for things to get better and for things to change. That was Jim Rohn, the guy who used to coach all these real estate people, used to say that, and then he became real famous and he's passed away anyway. It was really interesting the way he used to tell everyone things that were like so logical, and then people thought, oh, what, that is it that simple? Well, maybe it's that easy. It doesn't mean you don't have to do 100 other things that he's not talking about, but
yeah. So, okay, we're going to talk about your book in a moment, but the one question I have for you as a doctor, you go to school, you get your education, you learn your craft, you learn medicine, and you graduate, and you're a doctor. That does not mean that's the end of your learning cycle. Things change. Methods change, new treatments, new learnings. How do you, as a doctor, continue to learn, continue to grow while practicing, serving your community, writing a book, being everywhere online? Where do you find time for yourself to grow, to learn, and to expand your knowledge so you can help more people? The reason I'm asking is there's people listening to us, whether they're in the medical field, they're maybe just a reader, they're a writer, and the challenge of constantly growing and learning and educating ourselves is a challenge I think is universal for everyone. But in your profession, you're dealing with things that can change somebody's physical life and have big impact on people in their health. So I'm really curious on how you continue to learn and grow in your doctorate.
Well, that's kind of like a big question. So what I've noticed, I noticed this is the same topic actually. You thought you were bringing up a new topic, but this is the exact same thing we were just talking about. So I'm having all these problems with acne. Then I have cystic acne. Then I go and I get help, and then the acne goes away. When I take the Accutane, my skin became smooth as a baby's butt. I didn't tell you that, but my skin, all my acne went away. But the problem was I was so sick. So then I found somebody to help me. So really, I'm convicted about what I'm doing throughout the whole process. I went to chiropractic school for a reason. I wasn't like, oh shit, I'm like 30 years old. I don't really have a career. I might as well find one. What the heck? I might as well do. I mean, this seems like a good enough one. I can't get into medical school, obviously. My grades aren't good enough. So what am I going to do? I'm just going to go to chiropractic. No, that's not what happened. Okay. What happened was I had an issue with my health. That was a big deal. My whole life was like complexly involved in this process. I even went to this friend of mine who's a psychic. His name's Dr. James Silva, and he's coming up with all these different things I could do for a living. One of them was I could be a writer.
Nice. Yes.
Right. Check. I could write books. And I'm like, I want to do that one. I want to do that one. He's like, no, that wouldn't be the best thing for you. And then I said, well, I could study acupuncture. He's like, no, not that one. I'm like, I could go to chiropractic school. He's like, no, not that. I'm like, damn, man, like, what the heck am I going to do? He's like, well, it's something where you're serving the community, just something where you're helping people. This guy went to chiropractic school. He'd been a chiropractor, and then he became disabled, and he couldn't walk. He's in a wheelchair, and he's not well known. Almost nobody's heard of him. Dr. James Silva, nobody's heard of that, right? So, but to me, he's famous in my mind, right? So then we're doing all these muscle testing. That's what an applied kinesiologist does. That's what I do. He does all this muscle testing, and he finally comes up with, what if you did like acupuncture and chiropractic? Yeah, that's what I want to do. I want to do acupuncture and chiropractic. But can I write books? He's like, no. I'm like, damn, man. But I mean, it seems like it would be a good idea. Like, I have a lot of things to say. I mean, people would be interested. He's like, I'm not interested. That's like, okay, well, if you're not interested, then I guess you have a point. Like, you don't even care. Like, nobody's going to care. But listen, I went to chiropractic school. I studied acupuncture. I got my degree. I became a professional applied kinesiologist. I learned how to help people with the same symptoms I was having help with, the things that were basically going to keep me from ever doing anything with my life, right? And then I practiced for 16 years, and then I wrote a book because it's probably like now I have something to talk about, right? Something important. And it's all kind of a circle, right? Like our economy. Oh my God, what's going to happen with the economy? I don't know, but it's going to get better after it gets worse, and not everybody agrees with that, but that's my opinion. So, so what people who are, thinking about becoming great authors should think about is get back to the beginning. What's important to you? Whatever is important to you, that's what you're going to be writing about. And then you're going to write that book. You need to have a coach. You need to not spend too much money. You don't want to become an Amazon bestseller and spend $2,000 or $3,000 to do that because you're going to become an Amazon bestseller anyway. Just take your time, relax, find out who do you know that can help you to write your book. And maybe your audience only has 86 or 89% of the people that they know that can help me to write their book. I mean, that can help them to write their book. But still, if that's a lot of your audience, right? So there's only, 10 or 15 people, 10 or 15% of the people listening to this that this wouldn't apply to. But for the majority of you, 85 or 90% or whatever, you know people who know people who know people who know people. So, I went to this, one of the reasons why I got so sick is I worked for this environmental and health company. At the time, it was called Equinox International Corporation. They became the 25th fastest growing company in America right around what year was it? It was 1997. Yeah, 1997. So I was, part of that. And then they got shut down by the Securities and Exchange Commission because they didn't like the way the owner of the company was running things. It was like one of these network marketing companies. But the point is that I learned about meeting people, and I learned some, not too many, but some basic business principles and marketing principles. But you don't have to go through all that. You just need a good practice management software like Perfect Patient or High Level or Go High Level. I use something called Go High Level, which is really good for organizing my list of patients. You need to communicate with your tribe, with your group of people. You need to advertise. The only place I have successfully advertised has been social media, mainly in, you've heard of it, Facebook or Instagram, and then occasionally somewhere else. But so you need to really think about how long you're going to do whatever you're doing for. Like, I'm going to be helping people with their health for a long time. I've already done it for 16 years, and I have more than 16 years ahead of me. So I'm not like looking at this short term. I'm looking at this as a long-term, slow kind of a progression towards the way I want my life to go. And so, I knew somebody who knew somebody who knew somebody else who knew somebody who referred me to Dominic Damasky, who Motivation Champs is the name of his company, who referred me to you, Dave. And so David, it's not about like this one thing. It's about everything. And the everything should be, again, just being repetitive. You got to be excited. I was excited about helping people with their health. Yeah. I didn't know what the hell I was talking about. Thank goodness I didn't write a book. I was telling people apple juice is safe. Why? Apples are natural. They grow. If you eat an apple, you're just eating something that grows off a tree. Yeah, you're also having something that's a food with a glycemic index that's 70 or 80 that's so high that can give you diabetes if you have a couple every day. I didn't know that. I thought apple juice was even better because you just get the juice of the apple. You just get all that beta carotene and like a whole food apple juice, like a fresh apple juice, right? But no, you're just pulling out all the sugar and putting it in water, and now you have the vitamins with it, and now you're getting a sugar injection into your blood directly, and now you might feel a little better for a couple minutes, and then you can get a new diabetes that way. Or you don't have to get diabetes. You can get Crohn's, heart disease, you can get sacroiliitis, you can get Hashimoto's, you can get thyroid, you can get all these other diseases. You can get, you don't have to worry about getting diabetes. You can choose from among any chronic disease. Yeah, sorry. You can
late breaking news here on the Living the Next Chapter podcast. The apple a day keeps the doctor away has now been debunked because you're saying it is a sugar rush, right? So interesting. Because that's all I've ever heard, right?
And you got all these people saying the opposite. Yeah, that's all you ever hear, and you got all these people saying the opposite. And so there's some doctor who has the name of the initials S and G, right? S like Skolnikoff and G like God or something. But, and he's really, 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 really popular, and he advertises also, right? And he advertises more than me, and he has a good budget, and he used to be this surgeon of some sort. So this guy, I'm sure he's great at surgery, and I'm sure he's great at this, that, or the other. But can he help you with your health? And is it possible to help a person? I have a question for everyone who's watching and listening. Is it possible to get help with your health without doing any kind of an intake? So there's no diagnosis. So there's no exam, right? And then there's no specific treatment after an exam because you don't have the exam to begin with. And then there's no follow-up to see how you progressed after the exam and the treatment. Is that possible? Can it happen? Can you just buy a book on getting healthier and get healthy?
Yeah.
I have one.
Yeah, there it is.
Where's my book?
Right there.
Oh, here it is. I want to tell you that you can just buy my book now, today. It's only if you buy it today at Skolnikoff.com, it's only $9.99. If you wait till tomorrow, it might be more. But can you just buy this book and follow it and have all your health concerns go away? Do I have a program like that? No, there is no such thing because the precedence of, I wish I did. I'm all behind it, but the precedence of healthcare is first you diagnose.
Right. Yeah.
You have to do that. You have to diagnose something. Yeah. If you don't meet the healthcare provider or talk to them or send them in information about your body somehow, there's nothing to diagnose. Then you treat. Then you observe the results of the treatment.
Yes.
It's but everybody's going around thinking they're going to get a quick fix with some book, with some, South Beach diet or keto diet or this diet or the Atkins diet or the this or that. And those things might be really helpful. It could be really useful. I even have my own little Candida diet thing that I recommend people. But everybody's different. And some people should be following my diet and some people should not be doing that, and everybody's on their own every person has had a different mother, a different father, a different air they breathe, a different environment that they've had, a different experiences in their life. So we can't treat any two people the same way. I think I might have gotten off on a tangent, but
that makes sense.
But yeah, an apple a day. That's it sounds good and it's interesting. And you know what? To be honest with you, back 100 years ago, an apple a day was perfect because the people who went off into the ships to go from one country to another, they were getting scurvy, because there was no fresh fruit or vegetables for months at a time because those ships were it was such a long journey for Columbus to go from, Italy or Spain all the way. He was Italian, but he was living in Spain, I guess. So to go from there all the way to the United States. That took a while at that time. And people could get these diseases. And if they could they had big barrels of apples, and if everybody had an apple regularly, they could prevent scurvy. So that really would help a lot. But we are all so it's confused in a way that's profound in this modern age that we're in with all of our computers and radiation and all these problems with the environment that it's not funny, Nowadays we're under too much stress. Stress builds up a hormone called cortisol. Cortisol is the stress hormone that increases the amount of sugars. In other words, it breaks sugar down. So you got cortisol breaking another hormone called glycogen. It breaks it down and it puts more sugar in your blood. So now you have more sugar in your blood. And sugar is it ages you from the inside. So it makes all this fat deposit up here. We're not working in the fields anymore. Most of us, we're not doing a physically demanding job. I'm sitting here at a podcast. I'm not even running right now. I'm not walking. I'm not standing. I'm just sitting down talking to you on the phone. I'm moving around. I'm getting active, but I'm not doing anything. So if I'm increasing my sugar levels too much, we no longer have to prepare for the cold winter where 20% of the population is dead at the end of winter. Nowadays we have, heating, we have sanitation. Buy the book, Invisible Rainbow. I can't remember who wrote the book. I'm so sorry. But this lady who was a medical doctor wrote the book. It talks all about how in 1860, humans, people in the United States were getting eaten in hospitals. Little newborn babies were getting eaten by rats in hospitals. This was our history. That was 1860. That was not that long ago. And nowadays, that's all changed. We have relatively clean hospitals, so to speak. And even though it's still a dangerous place, we just don't have rats eating you in the hospital. That's what I'm saying. We have more sanitation, and they have sterilization techniques and all that kind of stuff. So we don't have the 1918 Spanish flu pandemic. This new pandemic is not exactly the same as it was 100 years ago. And even in 1918, there were some interesting similarities between that pandemic and this pandemic, which we will not be talking about right now.
So let's go to the books. Again, I'd love to when you show me the book. I love when my authors, when they come on the podcast, they hold the book up and show their book. Obviously, you have to do that. So this is not just a one book thing, right? We're talking about there's a partner to this that's going to be coming together. Is that right?
Yeah. So you buy the first book, and that goes over the approach to healthcare that the Skolnikoff Method utilizes. And then the second book is how you follow that approach. It's like the techniques. And I can't remember if it was who was asking me. I think it was you. You were saying like, well, what do you do to help people with their health? And well, that's not going to stay there. I give up on that. So the thing that you do is you do the things that have always worked in healthcare. Everybody wants to reinvent the wheel. Everybody's coming up with like all these great things. Like the Skolnikoff method is actually not my method. I've learned all these techniques about how to use herbs, which have been used for over 5,000 years. How to use homeopathy, which is a couple hundred years old. It was developed by Samuel Hahnemann and perfected by somebody named Kent. How to use nutritional supplements. Like, what a concept, nutrition. Oh my God, like maybe on a lab, you see you're low on vitamin C. How do you use it properly? We don't want to treat symptoms with nutrition. If you see low iodine on a lab, the person's low on iodine. They'll probably benefit from taking iodine. Why are they low on iodine? What's causing the iodine deficiency? They have a metabolic problem that has to do with whether it's a female or a male. It has to do with their reproductive system, and it has to do with their thyroid, and it has to do with their whole body and their brain and their liver and everything. So you don't just give iodine. You have to figure out why they have that problem. What's the cause? Why am I breaking out in this skin rash right now when I'm a little kid and I'm at the doctor's office? Well, maybe I have a huge test and I'm nervous about it and I'm taking my test really seriously. Or you have a podcast or a TV appearance or whatever. You have to write a book or whatever. You have to market a book.
I have a doctor coming on my podcast and I'm nervous because I'm like, oh my gosh, it's going to be so great. Yeah, exactly.
Yeah. So book one talks about the approach. The approach is going to be, what are we going to do? Are we going to diagnose or not? Are we going to meet the person and shake their hand or not? Are we going to do this Zoom meeting healthcare thing or not? How are we going to do it? Are we doing it in person? So what is chiropractic? Book one. What are herbs? What are homeopathy? What's nutrition, flower essences, chiropractic? What's right left brain balancing? What is energy medicine? And what does it all mean? What is vibrational medicine? Who talks about it? Who's Richard Gerber, who wrote vibrational medicine? Is that guy a medical doctor? Is he a saint? Is he a priest? Is he a shaman? Like, who is the guy? So that's book one. Book two is how do you apply it? We use herbs. How do we use them? We use homeopathy, nutrition, flower essences, and we use something called bioenergetics. We have to help you with your lifestyle. We have to help you with the kind of water you're drinking. Because, oh my God, nobody knows, I don't even know, that over 90% of the body is made out of water. It may seem like it's only about 70% because we have all the solid mass. You might have heard somebody say like we're just big bags of water. I didn't know this, but each cell is mostly made up of water. So the cell components have solid material, but there's water outlining all that. So it's like everything that we have in our body is cushioned in water, including the bone, the hair, not so much the hair. I mean, there's all kinds of oil and moisture in the hair as well. There's maybe 10% of the hair is made out of water or a little less than that. So water is a pretty big deal. If you have the wrong kind of water, if 90% of your body's made out of water or more, you're in big doggy doo-doo. You know what I mean? You're up like a creek made of doggy doo-doo and no paddle. to go through the
Yeah.
creek with. So we need we need water. And then we talk about protein because protein means of utmost importance from the Latin proteus. That word in Latin means of utmost importance. And then we need to help with blood sugar because all these modern diseases are blood sugar diseases. That was why we were talking about cortisol a minute ago. And I mean, you know, and then we have to help with digestion or talk about digestion and how do you get your digestion working right. And it's not that, like my book is not going to solve every problem, but at least it'll get you on the right track. So you're not looking for somebody who wrote a book that'll solve every problem anymore. I mean, you got to start somewhere, right? I mean, I have all kinds of, we've developed all kinds of programs that'll allow you to get an assessment regularly. That's completely different than anything being offered anywhere in the market, except for the thing that we're offering, which is called bioenergetics, which is actually not really all that new. So bioenergetics assesses your body field. So that's using quantum physics. It's completely different. It's like quantum physics is not, homeopathy uses the stress of the earth and the vibration of something mechanically. So let's say we wanted to make a homeopathic salt preparation. This is just salt. And we could take that salt and we could percuss it or vibrate it about 1,000 times. And then we can take that and put it into water and then percuss it 1,000 times. And then we maybe just 7 ounces of water, like a distilled water. And we could put 7 drops of that water and put it into 7 ounces of water and percuss it 1,000 times. And we could repeat the process 1,000 times. And finally, we have this water with nothing in it except for water. Okay. But it has the energy of the salt. But notice that the way that we did that was with the gravitational field on the earth, right? So with quantum physics, or with this bioenergetics, also called infoceuticals, we take the energy of something, and it's your body. It's different organs and glands and cells and body systems in your body, and we get the field of it. Everything vibrates at a certain energy. So this can equal up to, creating a salt homeopathic remedy matches the vibration of salt, and that can then maybe help somebody who's always thirsty or something like that. There's actually a whole group of homeopathic remedies called Schulster cell salts, which is really interesting. They're based upon salt. So it's like a real thing. I'm not just making up stuff, But so you can use that. That's fine. But this is just on a different level. And so we talk about that. So we talk about the water, protein, blood sugar, and then we talk about digestion. And then we talk about some things that are really important, that are really simple, that most of us think we know about, but we don't know about. And those things are the 5 fingers of death. Okay. We talk about wheat, because a lot of people eat wheat, or they're exposed to wheat, or they think wheat's healthy or not healthy or something like that. Then we talk about dairy, like milk products. And then we talk about corn. Okay. And then we talk about, which is often genetically modified. Even the corn, which is organic, has been genetically modified because the cross-pollination from the genetically modified Monsanto crops blew all around the world, and the pollen ended up pollinating some of the almost all of the organic corn on the planet, which is really sad. Soy, we talk about soy. I guess that's number 4, and then we talk about processed sugar. Like candies, soda pop, brownies, and things like that.
Yeah.
So we talk about them so people can get educated. I mean, a lot of people are just like, oh yeah, I've heard this before. And maybe you have, but now we put it all together into 2 books in one. So you don't have to buy, 25 books, because I'm referencing all those books in the book. I think that's what you were asking. But yeah, so that's book 1.
Yeah, that's perfect.
And that's book 2. And then people can continue from there. They can pursue either my services or someone else's services or something, but they're now they're a little more educated, and I don't know. I don't think anyone should go without the book. I mean, I'm like pretty hardcore. Obviously, I'm opinionated as heck, and I'm opinionated about the own book, which I wrote. So I'm like, self-promoting here. But I can't imagine not wanting to be healthier. I can't imagine making something other than our health, unless it's a relationship, or someone else's, a loved one or something. But our health and our life is pretty important, because what do you have without health? I mean, you can't wake up in the morning. You can't do what you want to do. You can't spend time with friends. You can't think clearly. You can't be of service to your community. You can't be happy. You can't sleep well at night. You don't have any energy. You can't do anything. You're not even alive. You're no longer living if you're not healthy enough. If you're really ill, you just can't function. So I think everybody needs that. And if it's not them, they need it for someone they love and care about who's not as healthy as they should be.
Okay, so I was just thinking as you're talking, a two-legged stool that you would sit on requires a lot of balance to try to sit on two legs. So that third leg is really good, right?
Let me try that.
That third leg is really good for balance. And what you're talking about is those three legs, which is a great stool. So I'm hearing two legs of the book. Is there a third leg coming? Maybe a results-oriented, hey, I worked through book 1 and book 2. Now here's my results. Is that maybe in the works down the road, do you think?
Well, there are, but like I don't want to. I am changing the subject, but at least I'm making the announcement. So yes, and sort of like not quite completely yes. So we're talking about the book 1, which is the approach. The book 2 is how do you apply it, and we also have services that we can offer people where they can, even anywhere in the world, they can come to our weekly Zoom meetings and they can actually get assessed and get support with their health. The only, it's a little challenging because there's more than 1 or 2 people in the Zoom meeting, or you could do a private meeting, or we even have concierge care where, especially in the state of California, but throughout the country, we can travel to see you and treat you in different states and different parts of the country. It's a little tricky. It's not necessarily cheap, but if you're 82 years old and you can't think clearly anymore and you have dementia and you need help and you were just recently diagnosed, man, why would you not want to do this? Why would you not want to get help with something that you know is going to work, that's going to get you the results that you're looking for? So I'm just trying. I don't want to sidestep anything you're asking me. So let me see if I can do a better job. I think that it's important to get the nitty-gritties taken care of. We don't have to we already have the spaceship that goes to Mars with people in the spaceship who are alive. They make it to Mars. They can set up little communities there on Mars, and they can live for months and years, and then they can come back to Earth all intact, alive, and well. We already have that, so we're not trying to redevelop that. But most people just don't recognize that that's actually here, and we have it, right? So we just want to educate people and let them know about what we're doing. We don't need to reinvent the wheel. Most people, they're used to their carpenter who has the hammer and the chisel and the nails and the wood glue and the saw. So we have the spaceship developed by the NASA scientists that goes to Mars, guys. It'll get you there. You can have the community and you can come back, right? So the first book and the second book, they come in one. You don't have to buy 2 books. You just buy 1 book. They go over autoimmune disease, thyroid disease, mood disorders, hormone imbalances, and gut problems like Hashimoto's thyroiditis, Graves' disease, rheumatoid arthritis, asthma, Jorgen's syndrome, Crohn's disease, all these ankylosing spondylitis, Crest syndrome, scleroderma. These are all autoimmune diseases. Nobody even told most of the people listening to this, if for some reason they have one of those diseases, that their problem was with their gut. Their problem was with their digestion. Nobody even told them that. So we don't want to come up with books 6, 8, 10, 12, and 22 and tell them that, no, it doesn't really exist. You can't really get to Mars. You can get to Mars right now, today. But you need to find out about it. You need to get your ticket. You need to pay for the ticket. You need to get on the spaceship. You need to reserve your spot ahead of time because we're getting a little fill with our spaceship schedule, so, that kind of thing. So people don't even know they can get help, right? People who have Hashimoto's thyroiditis, they're feeling confused. They're feeling frustrated. They're feeling annoyed and angry, and they don't know who to turn to or who to go to get help. Somebody like Elena Saxton, she was, really not well. She was not even 30 years old. She was only like 28 years old when I first met her. And she came in and she was referred by her partner. She has a skincare company called Luminance Skincare, and I get a lot of their natural skincare products because they're safe for my patients. They're solvent-free for the most part. And then her partner was a diabetic, so he was under care. He referred her. She came in. She has Hashimoto's thyroiditis, and nobody was able to help her, really. She'd been to somebody who helped her to use this little bit of progesterone that gave her a tiny bit more energy. But if you take progesterone, now your body's making less progesterone. So that may not work too well. Okay, so that's not going to work, right? So that's not going to work long term. It's like a man who gets testosterone. They go to the gym, they're lifting more weight, everything's going great. But, you could die, right, from testosterone. If you get too high of a dose, your heart can enlarge. You're angry at everyone. You're getting flushed. You can't think clearly. It's messing with your brain. I mean, you try to get that man off the testosterone if they're used to it for a couple months or years. They're not going to let you take them off their testosterone. No way, because, they're a man, of course, is one reason. Yeah. I know, I'm a man, you're a man. And the other reason is because, they feel better using it. Why would they listen to you? So it's like, just don't get me started with that. Okay. Anyway, so what is my point? My point is that, we can actually help. There's actually somebody who's figured this stuff out. It wasn't even me. I just have the Skolnikoff method. There's people like Dr. Viktor Frankl, who studied with George Goodhart, who developed professional applied kinesiology. Dr. Viktor Frankl knew about Robert Rittler, who had the Rittler sequences. He knew that if you stimulate certain bones in the spine, that the ganglion, the nerve cell bodies, all come together at one point. There's hundreds, if not thousands, of nerve cell bodies that all come together and they converge right where your spinal vertebrae are, which is the same place where the traditional Chinese medicine associated points are. They call them the dew points if you're speaking in pinyin, like in Chinese, but I don't speak pinyin, so I just go with the associated points. Okay, they're relating to the bladder meridian. So there's one for the spleen, liver, kidneys, the stomach, the pancreas, the heart, the small intestine, the thyroid, the thymus gland, the adrenal glands. There's a point there for everything, and you can just tap those points, and you can get those organs and glands to work better without prescription medication,
right?
Without any surgeries. And Candace Pert, who developed, oh my God, you have no idea. Candace Pert, who developed the opiate receptor, knew all about this, and she talks about it in her book, Molecules of Emotion, right? This is the lady who found out about the opiate receptor. She found out about all this stuff. So Robert Rittler, before the 1960s, discovered all this stuff. And so this is all. None of this is new. We're in the 2023 now, in a month, or less than a month. This isn't anything new. So Dr. Viktor Frankl taught total body modification from the 60s up until he died about 6 or 7 years ago or so. And that's available to people. And the company still exists. And so is professional applied kinesiology that utilizes similar technology. And just basic chiropractic is part of that. And then there's acupuncture, which has been around for 100,000 years, and the conventional medical community has just spit on it and laughed about it and made jokes about it. The reason why is because they want to have they want to have the conventional medicine still, but there is no reason to have it really. If you combine all these powerful prescriptions with something safer, like, homeopathy and herbs, if you need to do a surgery, you should do it, but you might as well do safe surgery and try to prevent as much surgery as possible. This is like, thinking that nobody's thinking. You should be thinking thoughts like these thoughts, but only the healthcare providers like myself are doing this. Everybody else thinks we're crazy unless they're under our care, and then they realize they better find someone like us, otherwise they'll be in trouble. So anyway, all this stuff has been figured out. So if we already know what the sequences are, if we already know how to help people like Elena Saxton to get over all of her symptoms, she couldn't leave her place. She couldn't go out. She had no energy to do anything other than eat dinner and go to sleep. She couldn't think clearly. She didn't want to talk to her friends or see her friends. I mean, once we started treating her, after just a few months, she's off her medication. She's off her progesterone. She's able to go out. She's able to function. She's happy. All her symptoms go away. She wasn't really overweight, but she lost, just 1 or 2 pounds or something. Her relationships improved with her friends and family and her boyfriend. She can work full time. She can, do podcasts. She can, her business doubles. I mean, it's like, it's pretty amazing. She's not having cloudy thinking anymore. She's able to sleep well at night. She doesn't, it's just a complete transformation. She's actually happy. I mean, it's a complete switch around. So, but if you don't know who to go to, if you don't know who to get help from, if you're so, it's sad when you have Hashimoto. Like, I didn't know who would help me. I was going to all these different healthcare providers. I was taking a handful of pills to wake up in the morning, before I met Dr. Bushin. I was taking a handful of pills to function throughout the day. I took another handful of pills with breakfast, another handful of pills with lunch, another handful of pills with dinner, and then another handful of pills. We're talking like 6 handfuls of pills per day, another handful of pills to go to sleep at night. Finally, to get rid of all those pills, if that was the only thing I did and I didn't feel any better, that would have been a big accomplishment right there, right? But I actually felt better without the pills, with just a few things that he gave me, than I did with those pills, And so I didn't need any hormones. That wasn't my problem. I didn't need to take like ayahuasca journey thing. I didn't need a shaman. I didn't need to take acai berry. I didn't need to do anything fancy. What I needed to do was change the water I was drinking. I needed to eat more protein. I needed to get help with my digestion. I needed to balance my blood sugar. I did simple things that have always worked in healthcare, that every healthcare provider who's ever helped a patient help somebody with. In other words, yeah, I could write a couple books, and I'd probably write about autoimmune disease more specifically, thyroid disease more specifically, mood disorders more specifically, and hormone imbalances more specifically. And I could write about gut disorders in more detail, because there's so many that are so important. But really what people need to know is that you need a healthcare provider. You need a coach. Stephen Curry and any great athlete like Michael Jordan, they always had a really great coach. And it was the coach that was helping them all along the way to show them what they were doing well, what they could do better, and what was that kind of thing. And so that they could, get even better than they already were. You can't do it without a coach in any area of life, whether it's finances, writing a book, getting healthy is what we're talking about, or being an athlete, so you always need to have a coach. It doesn't make any sense to try to do it on your own, when there's somebody else that can help you, which is what we talked about before. So I could write about those different subjects, but I never want to go away from what works. What works is what's always worked. What's always worked has been eating enough protein, drinking the right kind of water. Homeopathy's been working for a few hundred years. All the royal families in England and Germany and Switzerland and France, they use homeopathy. The imperial herbs from China have always worked, and so have the other herbs all over the world, especially in India, and even the American herbs. They had all these vitalistic healthcare providers here in the United States who in 1918 saved everyone from dying during the 1918 Spanish flu pandemic. They had 40,000 times better results than the medical doctors who did not use the herbs and did not use homeopathy and did not use flower essences and did not use chiropractic. 40,000 times better results. Those stats are mainly coming from the state of Iowa, but still, they're pretty universal throughout the country. Just the records are better for Iowa for some reason, because they had Palmer in Iowa. Palmer School was in Iowa teaching chiropractic and whatnot all the way back then. And so, we don't have to change that, right? We don't have to change anything that's working. We just want to help educate people and make it available and let them know that they've been duped, they've been fooled, they've been scammed, they've been lied to. And then they call the sickness pattern a Latin name, and all of a sudden you think you have a Hashimoto's and you feel better. You feel better just knowing you have a name. Your name's David, my name's Ilya. I mean, that's great. I feel better now that you know what to call me, and you call me by my name, and I'm like, I feel important. Dr. ILYA SKOLNIKOFF, I feel special. But that's just my name. Without that name, I'm still the same person who you called that name to before. So it's not the name. It's how did I get to where I'm at now? What did I do? What am I thinking? How am I, what is it that makes me the me that I am here? What makes you? And what causes a person to have the problems that they have that lead to their diabetes or Hashimoto's or Graves' disease or ankylosing spondylitis or their severe, stress headache or whatever they're having? I mean, you can call it a stress headache. You can call it a migraine headache. You can say they're different. You can do whatever you want. But what's causing the headache? What's causing the Hashimoto's? What's causing your condition? And you have to address the cause. There's always, without any exception, whether you follow what I'm saying, whether you believe in what I'm saying, whether you listen to what I'm saying, whether you agree with what I'm saying or not, there's always a structural concern, meaning a part of your body, There could be a bone, ligament, muscle. These are all structures, an organ, a gland. There's even body fluids they're structural even though they're liquid. There's always a chemical component, meaning what we're eating, what we're drinking, what we're coming into contact with, what we're breathing. There's always something that some people might swallow something or use a personal care product or deodorant. They might have metal fillings in their mouth. These are all chemical things that we're dealing with every day. There's radiation coming from the computer right now. There's air that I'm breathing. My radiation is different than your radiation, and my light is different than your light. Everybody's different. There's emotional things that we deal with in our lives. Maybe you get a little more stressed out with a test that you took when you were a little kid than I got stressed out with a test that I took, because maybe you had a family member or something that flunked out of a certain school program and my family members didn't. But I get more stressed out just when I'm talking to a female, and you're more likable when it comes to talking. Like everybody's different. So I'm not going to get the same healthcare treatment that you will, but we do have those three components. And so we have to see that. We have to recognize that the triad of health and the Skolnikoff method are real. They exist. They've been around for a while. They've been utilized in different parts of the world. They're incredibly effective. We have to kind of like get on a level playing field and say, who gets results in healthcare, right? Who's really getting results? Exactly. Well, if a surgeon removes a tumor and the tumor is gone, and you see that on a film, whether it be an MRI or whatever, we know that surgeon's getting results. You can't ignore that. And if you go to a holistic healthcare provider and you do a lab ahead of time and you see a tumor, and you go under care for 4 or 5 months and you do another lab and the tumor's gone, it could have been the holistic healthcare provider. I mean, it's possible, especially if you were seeing them once or twice a month and that's the only thing you did. Like the conventional medical community wants to say, no, it wasn't the holistic healthcare provider. No, you did the lab beforehand and you did the lab afterwards, and you see that the tumor's gone. But what makes you think it was the guy that you were seeing that was helping you with your health for 4 or 5 months, at least once or twice a month, that gave you all those herbs, homeopathy, and nutrition, and did all those therapies with you, did the vibrational medicine, did the psychospiritual, social therapies. They did all the they did the energy medicine, vibrational medicine, the emotional therapies. They did all that kind of stuff. They helped you to deal with like rebirthing, all that kind of stuff. They did the shamanistic therapies. I mean, why would you think it was him or her? Like, what do you think? It's just going to happen spontaneously? The tumor that's killing you just goes away on its own? You weren't doing anything else? Some people meditate and they do all these things. I mean, common sense is necessary, right? We're missing a lot of that these days. So, but we don't want to, this is not about experimentation. This is about diagnosing first, observing the need for some kind of therapy before you even do a diagnosis. There should be something that you want to get help with. Like if all your hair is falling out, maybe you want help with that. Or if you have a rash, you want help with that. So you diagnose, why is the hair falling out? Why is the rash there? Then you provide the therapy, right? So you got to do the diagnosing first. This is a book. It's an amazing book. You should buy it immediately, but it will not diagnose anything. You need a machine or a healthcare provider to diagnose. And then you also need somebody to interpret the diagnosis. Like, what does it mean? You can't just do it without some kind of a coach or healthcare provider or practitioner, whatever, consultant, whatever you want to call these people like myself. And then you want to provide the therapy and observe the results. And then you go back to the beginning, diagnose again. Is there anything else? Let's say I had headaches every day, all day long, and then they went away, but I still have them once a month, and they're really bad, and they last all day once a month. We got to re-diagnose. Why did it get so much better? Why do you still have it once a month? How do we get rid of it now once a month instead of every day? And how do we keep it from coming back even once a month, right? We don't want to just be left like stranded in the desert like conventional medicine does, said, oh, you have headaches, it's just normal, just take an aspirin, or just, I have an aspirin deficiency. Oh, that's my problem. Where are my aspirins? Well, I didn't take enough aspirin in my breakfast cereal when I was growing up. What did I do with my aspirin? Yeah, here's my aspirin. I'll just take more of these aspirins and I should be fine. It's like, no, there is no such thing as an aspirin deficiency. More people die every year from NSAIDs, non-steroidal anti-inflammatory drugs, than die from AIDS, AIDS, autoimmune deficiency syndrome. So if more people die from these anti-inflammatory steroid type, non-steroidal drugs than die from AIDS, then maybe we should think about that. Should we start an aspirin foundation? Should we start a Tylenol foundation or an Excedrin foundation? No, this is crazy. We just need to think logically and clearly and not get so confused by all the marketing and all the propaganda, which is so powerful and alters people's thinking for so long, especially if they're watching the Super Bowl at the time that they see the ad, because those ads are so powerful they can influence a person's thinking for more than 6 months at a time. So, I mean, that's what I think we need to do. That's my opinion. I don't think you're asking me all that, but I have long answers.
No, I love it. So, Dr. Ilya, you talked about Zoom meetings and things. What is the process for somebody listening today? They buy the book and they would love to either have more interaction with you and your team. What does that look like, and how do they where do they go for that information? First of all, I would love to kind of share that as we close off.
Fortunately, they can go to our website, which is Skolnikoff.com. It's S like Sam, K like Carl, O-L, N like Nancy, I, and then K-O-F-F like Frank. And at the bottom of the .com, and at the bottom of the page, they can fill out a questionnaire if they're having trouble with their weight or with chronic fatigue syndrome or their thyroid or their adrenal glands or something like that. There's a form there. Or they can just email me directly. There's also a little way to email me there. They can find me on the internet. Okay. I'm like Dr. ILYA SKOLNIKOFF. I'm sometimes they call me the one-stop pain doc on I guess that's on Instagram.
Nice.
Yeah. So yeah, that would be the way to do it, I suppose.
Okay. I love that. And before we close, again, before we recorded today, I did a quick search, and like I mentioned earlier, you came up everywhere. Congratulations. That's good to see. But you've had, again, go back to what I mentioned at the beginning, you've had a chance to talk to some amazing people and do interviews, have some pretty candid moments with some pretty amazing people around the world like yourself. And I really do appreciate having you here. Can you, of all the times that you've had this interaction with these great people, is there any one of these that stand out to you, maybe where you were a little bit starstruck or a little bit like, wow, I get a chance to talk to this person? And because I would like to include that in our notes so they can watch that. But what did you learn from meeting somebody that you admire in your space that you were able to kind of glean from them? I've gleaned so much from you today. Thank you, by the way. But what have you learned from maybe some of that encounters you've had that you've shared online? How has that changed?
Well, I feel really fortunate to have met a lot of these celebrities. Some of them I actually went to high school with, like Sam Rockwell. He was in The Green Mile, and he's in all these movies nowadays. And there's two people. So Sam Rockwell, I don't have any photos with him, but he always used to be focused on acting, right? That was his whole thing, was he's an actor, and he's really good at acting. I wouldn't say he's so good at a whole lot of other things, because that's my opinion. But he's really good at acting. He knows how to use his body. He knows how to talk. He knows how to pretend like he's someone else. And he can do all kinds of stuff. And so in high school, he wasn't even getting such great grades. He was flunking out of a lot of classes. And I always thought, what's going to happen with this guy when he finishes high school? We're all like 16 or 17 years old. And he was a year ahead of me. But then he ended up graduating after me because he was flunking out of so many classes. But the reason he was flunking out of his classes is he was so focused on his acting, right? Now he's a working actor. I mean, he probably makes 10 or 20 times more money than you and I combined every year, at least. And so I just remember him just having a good time, doing a lot of partying. He was happy. He was having a good time. He was focused on his acting. He didn't let go of that focus. Even when he wasn't making a whole lot of money a couple years out of high school, he still continued with the acting, and almost it seemed overnight that he became this huge success in Hollywood, and everybody knows his name, and they're putting him in. He's constantly working. He's very much a working, wanted, sought-after actor. He's one of the top 100 for sure. And he's not just a character actor. He plays main roles. And so he worked really hard for a really long time. So that strikes me. Same thing with Margaret Cho and some of the other people I knew in high school. I went to the School of the Arts in San Francisco. And then another thing that struck me was Dog the Bounty Hunter was really down to earth. And I thought I had problems, and you think you have problems. Man, poor Dog the Bounty Hunter. I mean, really down to earth, really good guy. He's out to help people. He's out to help people to be safe. He wants to bring in criminals. He's not really a criminal. He's just a guy who sometimes in the past had a difficult upbringing in Texas and hung out with some of the wrong people. And then he ended up going to jail for a while. But his wife died of cancer. And he said, wow, if people in the public knew, especially the healthcare providers, the conventional or holistic healthcare providers, if they knew 90% of the stuff that Dr. Ilya, then my wife wouldn't have needed to have died of 4th stage cancer. She wouldn't have needed to have all that inflammation, which then led to her getting the 4th stage cancer at some point later, that then led to her death. He said, I know there's something that grows from the earth, and that thing can be used to heal people. And people just haven't found out about you and all those herbs and homeopathy, and they haven't found out about this. So they don't make it. So they die. And I hope more people can find out. And he talked about how he has his own healing skills and abilities, these kind of like gifts, right? Where like he talks to animals, like sometimes birds will come and land next to him.
Amazing.
And he'll talk to the hawks and the birds. Yeah, they'll just come fly right up to him. And then he talks to them, and then they say something to him. He says something to them, and then they fly away. I'm like, wow, that's real. He's like, this is like a real thing because he's part Native American Indian,
nice.
And so he'll sometimes sense that somebody is a criminal in a crowd of people, whether he's working that day or not, whether he's paid to do it or not, and he'll rat them out so that they don't cause damage, they don't start shooting people, or they don't do some violent activity that could be dangerous. I mean, that guy is amazing. I really was grateful to get to know him and spend a little time with him, and he's got a copy of the book and everything.
Nice.
So, yeah.
Okay, so as we end off today, we've talked about so much, and like the amount of value you've brought, Dr. Ilya, to our conversation is outstanding. I'm going to have to listen to this multiple times myself. So I'm inviting everyone to go back and listen again and again. I've been taking notes the whole time you've been talking, so I have a lot of homework to do. But what I'd love to kind of do something unique at the end of this podcast episode, having you here with us as a gift. Could you give us an audio prescription, something we can do this week that can give us some health to get us on track, something simple that all of us can do that we can actually put into place immediately, and it will help lead us to healthier choices down the road. An audio prescription from you that we could take today and we can apply right now. What can we do in a small step?
I was thinking of like 6 things, but so a small step which is not going to help. Yeah, so the small step would be, try identifying foods that have wheat in them, WHEAT. And once you've identified them, now you want to try to cut some of those things out of your diet. Even if you're relatively healthy, it doesn't really matter. Just a lot of people take blood pressure medication, and their doctor told them they should take it, and they probably should take it, because their blood pressure is too high. But nobody's really making the connection between the wheat that they're eating and their blood pressure, because how do you do that? How do you connect the two? Like, they'll eat wheat and they feel okay. So why would that cause that? But they don't feel okay because they have a heart condition. Now they have heart disease. They have high blood pressure. And you may be listening to this, think, I don't have any problem, and I eat wheat and I'm fine. Well, I mean, okay, that's fine. So this is just something that I'd suggest. Yeah, you can try to eliminate wheat from your diet and cut it out. And that's one thing you can do. I mean, there's so many things you can do. Also, try to think about things that you can do that would be more healthy. Like, you could buy my book. Obviously, I'm going to say that, right? I'm really opinionated and in favor of my own book. Or you could buy someone else's book. And if the book talks about something that applies to you that's related to health, and you read it and you benefit from it, that would be a big deal. There's books like Grain Brain and Wheat Belly and Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal by Dr. Datis Karazian. There's a book called You Can Heal Your Life by Louise Hay. I'm giving you guys options, right? You could just buy one of them. There's my book, The Skolnikoff Method, which combines all those books. There's so many great books. And so, do something, and stick to it. If you're going to do the wheat thing, like, really do it. Another option, is it okay if I mention something else? Or Another option would be find a spring water. Yeah, thanks. So find a spring water where you live, whatever area you live in. I guess you're in Canada. And make sure it really comes from a real spring. Like in Canada, there will be real springs. And it should not be, let's see, what are they? It should not be a reverse osmosis water. So the water should not go through reverse osmosis. You'll have to research that a little bit. Like in our area, we have Crystal Geyser. We have Aquapana, which comes from the Pellegrino company. There's something called Starkey's water. There's something called an artesian. There's an artesian water, Simply Sedona artesian spring water or something like that. So you can get like a water that's safe, that's a spring water, and you can drink more of it. You should probably drink like a quart for every 50 pounds of body weight. So if you just weigh 150 pounds, you're already drinking 3 quarts a day. You have to drink a lot of water, according to what I'm saying, right? I mean, that's 3 quarts. Yeah, if you weigh 50 pounds, so that's 150, 3 quarts. Okay. So that's 2 huge things that people can do. I think that's a good beginning. You know, I think that's enough. I don't know. What do you think?
I love it.
Okay.
Again, you've brought so much value to the conversation. I'm so pleased and blessed to have you here. And our mutual connection with Dominic, that's just one layer of goodness on top of all of this conversation. So thank you so much, Dr. ILYA. Again, we'll have all the links in the show notes. You've mentioned books. You've mentioned all kinds of great resources for everyone. We'll make sure we capture that as well for everyone's reference. And as well, I would love for people to reach out to you. Purchase the book directly through your website. That's available, right?
Yeah, or Amazon, or just me, you know. But yes, the website's the easiest, probably. I think so. Yeah.
Excellent. I appreciate your candor. I appreciate your willingness to chat and just the time for you to give up time to be with us today and to share your journey writing your book, share your journey of health. And again, I love the fact that you are not just handing out prescription like just candy for people and not treating the actual source. Back to my example of my rash, I loved and had a huge respect for that doctor who saw past my condition and the results of my condition and addressed the exam, which was causing stress, which was resulting in a rash. He just blew through everything else. He treated the rash, but he also helped me address the reason why the rash even started in the first place. And when you started talking, my mind went straight back to that doctor. And it's doctors like you and that doctor from my past that are the ones we should celebrate, because you're not here just trying to get us to try a new medicine. You're here to help us fix the problem at the beginning. So thank you for doing that. It's outstanding.
Well, thanks so much for having me. I really appreciated spending this time as well. And we got to eat right for our diet type. We got to use the Skolnikoff Method. It is the new medicine. That's the old medicine. That's based upon the ancient medicine. That's based upon... Anyway, yeah, thank you so much for having me. And I've really enjoyed spending this time with you. It's a lot of fun.
Let's see that book one more time. Let's see you hold that book up. I love when you do this. There it is.
The Skolnikoff Method, New Medicine for a New You, the Inflammation Handbook. And it's actually the old medicine. So the new medicine is based upon herbs, homeopathy, nutrition, flower essences, things that go back thousands of years. But because everybody's been blinded and short-sighted and basically mind-controlled by the conventional medicine model, literally, I kid you not, people don't know that they have an option. So I'm calling it the new medicine. It's an option. And all these different ancient healing techniques have been put together by my mentors and myself and my colleagues, and it's available. People can actually get this kind of healthcare. We don't have to be plagued with all these chronic diseases, but we do have to make a few lifestyle changes, and they do involve diet, and they do involve things like that, like what we're eating and drinking, and maybe a little exercise or something. But at least we can be healthy. We don't have to continue with this craziness of, when am I going to get my next shot to keep me from dying from the new pandemic, and where am I going to go when the flu season comes around and my headaches come back and all this kind of stuff. So there's a way out, is what I'm saying. It may not be what people were expecting it was, but it's a way out. Yeah.
Excellent. Dr. ILYA, thank you. And I'm really looking forward to watching more of your journey, following you online, and getting more updates on how the book performs and what the future is for you. Again, I really appreciate your time today. Thank you.
Thanks a lot for having me.
Another great episode. So happy to have these amazing authors and creative people here on the podcast. You know, we actually have 6 other podcasts at the moment that we're doing on a regular basis. 7 total. TrueMediaSolutions.ca. TrueMediaSolutions.ca. Link in the show notes. Head over there. You can see all 7. Oh gosh. 7 podcasts that are currently in production here, including Living the Next Chapter. Did you know we have more? We have more people. There's more. Head over there, TrueMediaSolutions.ca. You might find your next favorite podcast, maybe. Love to have you join us on all the other shows. 7! LivingTheNextChapter.com and TrueMediaSolutions.ca. Links in the show notes. We'll see you over there. Thanks.
Mindshift Power Podcast, the podcast for teenagers and those who work with them. There's a huge problem in America today. There's a very large disconnect between teenagers and the adults who work with them. I'm looking to bridge that gap with real, raw, honest conversation, not held back by the chains of political correctness. You cannot solve a problem you do not understand. Want to understand teenagers today? Listen to this podcast. This podcast is for teens in the U.S. and Canada. To learn more, go to fatimabay.com/podcast or just look for Mindshift Power Podcast on any listening platform. I look forward to you being a faithful listener.